from the last week, this is our part 3 of the lecture series. In this series, we're going to talk about the COVID-19 lockdown exit strategy. This is a very excited, basically it's a very commonly talking topic at this stage. What are we going to do? Basic ground rules, please mute all of your mics, and also if you have any questions you can ask end of the sessions. Then I would like to tell you many of different representatives from different part of the world have joined. Welcome you all, and when I go through the presentation I will introduce you. Thank you so much for joining us with a very short notice. Now, in this presentation, I'm going to talk about 3 things. First thing is we have to understand is the flattening of the curve. This is everybody talk about this. I'll briefly explain because that is also very important when we talk about the lockdown exit strategy. Then the third one is the commonly using immunological test. There are a few tests. We have to understand which one we have to use, which time. So we have to have some sort of idea. Now, in the summer, if you see that there are normally the health secretary will talk about we will extend the period for another 3 weeks. Some already the USA starting to talk about the exit strategy, but probably it will be a little bit premature. At the same time, the UK also thinking about, and the Germany also, you can see that Germany has said the smaller shops can start opening. Why this talk is starting? How are they going to manage this? So that is the question. Okay. So now, as you know, in the last presentation, I mentioned this virus is a perfect serial killer and genius. What we are smarter than this. In this presentation, I'm going to prove to this virus, no, we are smarter than you. We are from this. We will never surrender. Okay, so I'm going to present our strategy to execute this virus. Okay, flattening of the curve. I'll give you a very little bit idea about this. Basic idea. What is this about this curve? This is our healthcare system capacity. That means our staffing level, our equipments, including the PPE and also the ventilation facility and everything, how many beds available, our hospital space and everything will be included in this healthcare system capacity. This is before the coronavirus. In the UK, roughly around 7,000 to 8,000 ventilation facility were there. So it was there before. Now, in this situation, if you don't increase any of these capacity, what will happen? Because of the number of patients that will breach. Simply, that will go up. And so the rest of these patients above this healthcare system capacity, unfortunately, they might die because we will not be able to provide the adequate support for them. So this is what happened in Italy because they did not expect this. Suddenly, the number of cases build up. They couldn't cope up. There's no enough staff, and also staff also affected. And the equipment, they did not have enough ventilating facility and all. The space was a problem. Everything crashed. Luckily, we had some time, so we prepared a little bit more. That how much we prepared, that's questionable. But anyway, so we prepared a little bit. So in our Doncaster Royal NHS Foundation Trust also, we have done our job. I would say we have done really good. Now, in this situation, what we have done, we have increased the number of staff. I think retired consultants or doctors also returned to work. Number of volunteers, they came forward. And also, equipment point of view, we increased the number of ventilators. According to this is a difficult part. When you ask the politician, they will not give the real number. But anyway, so we can summarize roughly around 20,000 ventilation facility at this stage in the UK. But is it enough? Is it it is normal when you compare with other countries? But they are expecting to increase up to 30,000. We don't know when going to happen there. But anyway, if you compare, for example, I'll give you a rough idea. In Canada, 37 million population, they increase up to 30,000 ventilating facility. But anyway, in this country, as you know, that more than 60 million people, so far we have 20,000. So you can get some rough idea what is our capacity. Now, still we can't leave that because there are more number of patients. So we have to keep these patients below this line. Otherwise, still these patients will die. That's a problem. There's no proper care will be given for these patients. So in this situation, what we have to do, we have to maintain the isolation, social distancing, and the hand washing, probably collecting the toilet rolls, and I don't know, that's what the people thinking that going to kill the virus or whatever. I don't know those things. And all these activities will bring this curve below the healthcare capacity what we have. So that's a simple explanation for this flattening of the curve. And also we close the school and close the businesses and we avoid unnecessary travel. But I don't know what does it mean by that. Yesterday I faced a very extremely big traffic block. I don't know what are they doing at about 7:30 in the morning. Anyway, we'll talk about that. What is a lockdown exit strategy? According to the WHO, there are 3 things important for any country. First, we have to identify the case and we have to take out of the circulation. That means isolate them or quarantine or whatever. And the third one is contact tracing. This is a basic idea, basic things every country has to do. But different country doing in a different way, and also some countries unable to achieve that. For example, identify point of view testing, how much testing we are using. But if you take China or the Korea, they are doing really great. They did that very well. So there's different country managing in a different way. Why is that different way? And also, how can we come out of this problem? Because we can't continue like this. Because that will take a longer time. By the time we will be crushed by this virus. Now I'm going to explain. Sometime our trainees also asked several times. I couldn't, I was smiling. Oh, right, okay. So you have to read a little bit more. Basically, why the South Korea did that very well? Why the China did very well? Why we can't do that? We are one of the advanced country. Why can't we cope up with this? So what is the difference in the management point of view? What is the difference? So why we were not preparing for this? I'm going to explain a little bit about that. Then you will understand why we can't do like South Korea. So then you will get the idea. I don't need to answer that question. So when you watch the next video. Next one about the United Kingdom. So we will talk about a little bit the lockdown exit and also a few other countries like India, Sri Lanka, Nepal. So I'm going to give an example from these different countries. You watch this video, this will give you a reasonable idea how the South Korean did that really, really well. They came out of this problem very quickly. Right. As you know, most of the countries in the world now lockdown situation. We never seen this in our lifetime. But South Korea, the people started to move around as usual. How did this happen? In mid-February, the cases were identified roughly around 5,000 cases. Then after that, other countries' number of cases started to increase. But in South Korea, they managed to control that. They managed to flatten their curve, the back to normal very quickly. What kind of magic did they? So how did this happen? Because they learned from the past. In 2015, cousin brother of our COVID-19 virus, this is a MERS virus, from that incident they learned. What happened in 2015, one of the Korean businessman traveled from China to the Korea. He had a chest infection symptoms. He was moving around different hospitals to find the problem. That situation, he went to one of the hospitals. They managed to find he's having a MERS virus infection. So by the time he already done the damage, he spreaded the virus everywhere. So the Korean government were panicking and also they tried to trace all these contacts. So they struggled a lot to control the situation. Then they learned from this mistake and then developed. That time 186 cases of identified from one patient, and after that 36 patients died. So they learned a big lesson from that. Then end of 2015, they announced we control the disease. They did not stop from that. They tried to build the infrastructure and all the technology, all the testing facility and everything for the future disaster. So this is how they try to learn this and they try to control the current situation. This situation, In China, December 31st, the first case was identified. The patient traveled to, Korea. That time only they diagnosed 30 cases in South Korea. But they did not stop in mid-February, actually. Then they immediately started to produce the testing kit, thousands of testing kit, and they prepared, and also they distributed all over the hospitals and all over the countries. So they expected the disaster. As expected, they faced the disaster. In 2 weeks' time, 3,150 cases. But they did not give up. So they are already prepared. So they started to test every single case they see in front of them. And also they isolated. So this is what happened. Patient 31 probably heard about this. This patient came to one of the hospital. Immediately they had the facility. They tested. They diagnosed as a coronavirus, the COVID-19. Unfortunately, this patient went to the church. In the church, with 1 hour time, that spread to other people. So somehow they managed to identify this person. Then they identified all the contacted people. They just checked every single person in the church. They identified some of them infected. And also, those people also infected some other people. So they traced every single person in the country. Roughly around 9,000 contacts had been traced. This is we call as a contact tracing. After that, they isolated or quarantined. And then after that, still they were continuously searching. What they did, they implemented a system called 600 testing points all over the country, including the drive-through testing system. Then, not only that, they built up, one of the networking system. They published in the web. That is how they traced. Not only that, these patients will move around. When they move around, what will happen? They will touch the doorknobs and also, a few other places. That will give the chance for the infection to another person. So they had a plan for that as well. What they did, now you can watch this. If somebody moves through this pathway, they can find all the people in that region. They test everybody. They test. They had a capacity to test from the beginning 20,000 tests per day. Not only that, they shared the information, personal data and everything, and in the web. So everybody shared. All the people can see those data. Probably a number will be given, not the name. And also they send the message to the next person. For example, if somebody walking through the street, if it is a coronavirus patient, they know that patient. So they will inform to the neighboring people, okay, there's a patient walking on the street. And also he is going to the pharmacy, he is going to the shopping complex. So the people will avoid that. They are shared the information in the web-based and also in the mobile phone. Then who will go near to that patient? This is how they build the system. So it's a very controversial situation. So people ask the question, how can you do that? You are breaching the data. They said, okay, public health come first. After that, they built this properly, and also other countries also started to follow. For example, the Singapore, the Thailand, and also they are following the things. That time, the UK country, basically the European countries and all, they did not take that much care. So that was the really big mistake. Now, they learned the lesson from them, and they are trying to introduce some of the things in the UK. So that is what happening. Now you can say, did we have the capacity to do that? Did we have the capacity to test it? We did not have a single kit for these IgG, IgM, whatever the simple kit. So we had few antigen testing machines all over the country. So we had 2 days to get the report. That was our capacity. So we couldn't manage that. That is the reason for this. Not only that, now I'm going to go to the next step. That is what happened in Korea, and also that's how they managed the situation. So they are number one. Now we'll come to the number two. We are number two. We are not number one. That is, we have to accept. That is a reality. Now I'm going to come. How can we manage in this situation? This is a really tough situation. So how can we come out of this problem? Otherwise, this will crash our country. Now, this is very simple information. 80% of the population will have this infection very mild. They will have a simple flu-like symptoms, fever, myalgia, something like that, some cough, and they will get it off without any much problem. The 15% of the patients, we need the admission, but simple, the supportive medication would be enough. For example, maybe normal saline or maybe paracetamol, or that kind of support will be enough. They don't need a very significant management. But 5% of the patients need the critical care management. This is the key here. Now, I'm going to explain something. I designed this slide for a 5th standard student. That's enough. We don't need to be a doctor to understand this. UK, we have 60 million people. According to the professor, our leading professor in the strategy, 60% of the people will be infected. He's expecting, or maybe a little bit more. That means it's around 40 million. For your easy calculation, I put the round figure. 40 million people will be affected or infected. Out of this 40 million, 80% of them, that is roughly around 32 million people, will be fine. They will get it off without any problem. But 15% of the infected people, that is roughly around 6 million patients, need the supportive management. As I mentioned earlier, probably paracetamol, some oxygen, some maybe normal saline. That's it. Few days time, they are come out of the hospital. But 5% of the patients might need intensive care management, like ventilatory support. So in this situation, if you see that number, it's around 2 million. Out of this 2 million patients, this is the key area. These 2 million patients, we have to see how many beds we have. According to the politicians, we have 20,000 beds in the country. But they're going to increase up to 30,000. We don't know when. If you calculate, okay, you assume we have a 30,000 beds. This is like this. For 65 patients, you have 1 bed. In other words, 65 patients need the ventilating facility. 65 patients are in front of you. And now you have 1 bed. So you have to select out of these 65 patients. That will be the situation, the worst scenario. In that scenario, I'm not going to tell you this is going to happen. But if you don't take care of this, that can happen. But we are having some sort of protective mechanism. That's why we are isolating, self-distancing, self-isolation, and also the social distancing, washing the, hand with the soap and all these measures. Okay? They close the school and everything. Now, you know that the mortality rate is 2 to 3%. That means, simply, out of these 40 million people, 2 to 3% will be 800,000 patients, 0.8 million patients, could die if we don't follow any protective measures. That is the expected number. I'm telling that's not going to happen. We will do something, right? But at the moment, so far, we lost 12,000 patients already died. But we have to think about it because there are unreported deaths in the community, in the care home. I'm going to put a big number, okay, for the safe side. Total 20,000. That is roughly around 2.5%. Okay? So now, we are still okay. We are doing good. $1 million. Now, this is according to the politicians that recently they published. This is the number of ventilators we have, roughly around 20,000. It's a simple question, but we can't get the simple answer from the politicians. That's the problem. And also that will be increased to 30,000 beds. Now, I will go for the very key area. You have to focus on this. You have to put the things in your mind. Think about what kind of decision we are going to take. This is the exit strategy model. The model that does not mean this will happen. But anyway, that's going to be the worst scenario and maybe whatever it is, that will be the middle most of the time. So this is the exit strategy. To explain this, I'm going to take a rounded number. Basically, if you assume this is our population, 100,000. For example, Doncaster, we have 400,000 people. Okay, the same model can be applied to anywhere in the country. Still, I'm going to take, this is our population, 100,000. As I mentioned before, 5% of the people will need the ventilating facility. That is roughly around 5,000 patients. Need the intubation. Simple as that. Normally, in the UK, we will have normal time before this coronavirus, we will have roughly around 1 bed for 6,000 patients. Okay? So now that is for 100,000 patients, there will be 15 beds. If you calculate the Doncaster, the same situation would be there. In this situation, we increase up to 3 times of the bed. So roughly, I think in Doncaster, 140 beds or something, maybe near to that number. You can see that. So in this situation, 15 beds will be increased into 4 times. Actually, it's a 3 times to 4 times. I'll put the 4 times. Worst scenario, okay? That is a facility. First day, 10 patient admitted. Second day, 20 patient admitted. Third day, 30, 40, 50, 60. Bed finished. So now, next patient will not have the bed. So you have to select. Are you going to extubate someone or you're going to let this patient die? That's a reality. You have to face the reality. So what we have to do, we have to keep these numbers not 10, below 10. So we have to keep some bed. That's what I explained that graph. The flattening of the curve. We have to keep that number below that line. That's the important thing. Now in this situation, that's why we have to manage isolation, social distancing, hand washing, cleaning the surface and collecting the toilet rolls and everything. Okay. Now, how many days will take to come out of this problem? Simple calculation. 5th standard will understand that. You assume the 5,000 patients. We can manage maximum 10 patients per day. That will come around 500 days. That is 17 months. I would say 1.5 years. Question is, are we going to continue this for 1.5 years? In that situation, the UK economy could shrink by 35%. Probably we might face the situation we can't pay the salary for the workers. That's the situation. Simple as that. Country will be in trouble. Now, currently, 1/3 of the NHS key workers already have been infected. They got the coronavirus anyway. So, simple. For 5,000 patients, 17 months. How can we bring this period down? That is a strategy we are thinking about now here. There are 2 options. One is herd immunity. I will explain that in a minute. The second one is vaccination. Simple explanation. People infected naturally will produce the immunization in their body. We call it as a natural immunity. So we have to get the coronavirus infection. We'll get the natural immunity for that. The second way is we have to give the vaccination to achieve immunity. At the moment, we don't have it. We don't have the vaccine. According to the scientists, and they are telling all over the world, this will take minimum 18 months because number of procedures, we can't get that before that. But luckily, because it's a worldwide problem, it's a nightmare. So now, luckily, the UK has announced this message. It's in my Facebook, you can see that. And basically, one of the scientists, professor, the Sarah Gilbert, she announced that she is 80% confident her team will be able to produce the vaccine by September. And also she added, she doesn't know whether this will work or not. But still, there's a hope. We can see some light. If the vaccine is available, fine. But we don't know that. That is the second option. So now we have to think about how can we do this. This is how the government is coming up with the idea. Now, I'm going to give you this information. You have to absorb this information. You have to think about this. According to Sir Patrick Wallace, he's a professor, and he is telling we can apply the herd immunity concept into this. Normally, herd immunity concept, we talk about the vaccination situation. For example, the measles. If you vaccinate 95% of the population, what will happen? That will protect the rest of the 5%. What does it mean by that? Rest of the 5% mean they can't get the vaccination. They will be all, maybe, I don't know, maybe some medical problems, epilepsy or any neurological problems, and maybe low immunity, the cancer, and so many other things. We can't give the vaccine for them. So the 95% of the population, if they get the vaccine, what will happen? The virus can't spread, because if the virus comes, what will happen? Because of the immunity, that will destroy the virus. So the virus will not be able to transmit through the population to reach those 5%. We call it as a shielding. Probably you would have seen this hand movement in the news from our Prime Minister or the Health Secretary. Shielding. This is normally we apply in the vaccination situation. Now they are going to apply in this situation because we don't have any other option. He believes, I don't. He believes, but doesn't matter. I believe or not, doesn't matter. If you give the infection for 60% of the population, they will be able to produce the herd immunity. They will be able to shield the vulnerable people. That's what the professor believes. So this will allow us, or this will be enough for us to produce the herd immunity. Other point, he mentioned that 80% of the people will be getting some very mild illness. So why can't they become as a herd immunity population? That's what he thinks clever. In that point, I agree with that. Okay, 80%. Let the 80% of the people get that illness out of this total population. I already mentioned that. Who are those 80%? We'll talk about that. This is a herd immunity. You need 60%. How can we find it? Whether we reach the 60%, we reach the 40%, 30%. They have come up with some idea for that. Okay, because we have to come out of this lockdown situation. I have to explain this. Make it very simple. Okay. It's going on the live. Okay. So there are 3 common tests. I'm not going to talk about too much in this. First one is antigen test. Second one is antibody test. In the antibody test, there are 2 types. One is IgM, another one is IgG. This is not a medical school teaching. Okay. So antigen, that's what we do in the hospital nowadays. We do that. The PCR test. The sensitivity is 30 to 80%. That means you might test in the early stage of disease. That will tell you negative. That is a false negative 20%.